This is OHSU, shaped by leaders, pioneers, and those brave enough to take that first step. We carry the torch and shine a light on what is possible. We are a collaboration of disciplines, listening to one another, learning from each other. The OHSU Emergency Medicine Residency Program is more than an opportunity to gain experience. It's your time to serve with a community of trailblazers and groundbreakers.
The type of resident that's successful in this program is the resident who's going to grab hold of everything we have to offer and incorporate that. The person who takes charge of their own education is going to be the person who explores different opportunities, who pursues the interests that they have, who dives a little bit deeper than what's presented in conference, and really kind of creates a mastery and an ownership of their education. And we have all of the opportunities for you to do that now in a protected and supportive environment, so that when you go out and become an independently practicing physician, you have those skills to continue that growth.
So as an emergency medicine resident at OHSU, we rotate through 6 different sites. And there's a couple things that I think are extremely beneficial about having the opportunity to do so. The first is that you get to experience a broad range of different types of practices, such as community, critical access, or university or academic medicine, as we call it. And it really helps you determine which kind of career you might want to practice at the end of your 3 years here. The other, I think, important piece about rotating through different sites is you're always going to be working with providers, whether you're at an academic hospital and they're over practicing at a community hospital. You're going to be communicating with them, and it's really helpful to know which challenges each type of emergency department faces. One of my most favorite rotations at OHSU is the rotation in Astoria. It is a town on the coast about 2 hours from Portland. It's a critical access hospital, and you get to go out there for the month, and you're working one-on-one with an attending while you kind of help run the emergency department. You are challenged in so many ways because it is a critical access hospital. You have such limited resources, and so it really pushes you to know how to practice in such a different setting. The patient population is also amazing, and they're very different from OHSU, so it's really fun to train amongst such different patient populations.
I love this job. I mean, it's the best job in the world. You get to work with residents and faculty and staff and students. And I think really the reason I do it is for our 3 missions and to support the patients. It's really rewarding to be able to see residents come into our program not knowing what they want to do and watching them develop over the 3 years. And then finally being on the transfer side of things, where we're on the phone with a resident that we trained 5 or 6 years ago, and just seeing what a great job that they're doing serving patients in our community.
So I think there's a few things that make OHSU Emergency Medicine Program special. I'd say the location, the people, and the type of program that it is. Of course, this is like Portland. It's like a city, but also just outside the city, you have that nature, that beauty. So those are that's one of the things. Also, I'd say the people. Residency is like a hard time. It's not the easiest thing because you're literally learning how to become a doctor. So you want to be around people that support you and are gonna be there for you. My relationship with my co-residents, I think our relationship is overall, we have a really good relationship. We bond well, we talk well, we have a group, pretty much a group text where we all talk about different things. Some of us have similar interests, some of us don't have similar interests, but that's normal. On the rare occasion where a lot of us, for example, 5, 6, or 7 of us are off, we'll group up and have game nights with our loved ones, so we'd have those game nights that we play games. Another things that we play pool, and sometimes it's just chilling and going to a brewery and just relaxing, just something simple like that, because it doesn't have to be something that's extravagant or anything, just chilling, relaxing, and just talking about how your time is going. during residency. So those are some of the things that we've done so far.
Residency is going to be hard wherever you go. So one of the things that's really important is that you find things that are going to rejuvenate you. And one of our beliefs at OHSU is that we want to support you in that. We encourage you to explore things. We want you to go out and experience something you've never done and see if that's what you want to do. Because really, knowing what you like and knowing what you don't like is just as important for a whole career as being really good at what you do clinically. And we really feel that that is an important thing that we can offer you.
At some point, it's about the why you do what you do, as much as the how. We do it because we are bold. We do it because someone needs to make the difference, and we know we can make the difference because we already have. We welcome the curious, inspired, and those willing to be bold. What is the difference you want to make? This is OHSU.